Hi everyone, thanks for joining us. Today's topic is how to decompress your low back for instant pain relief. So let's first get into some of the basic history with why you need to decompress your low back in the first place, right? So most people, when they talk about decompression, they're talking about taking literally the pressure off of your discs, okay? Or taking pressure off of your facet joints, or of your low back, or of your low back or your lumbar spine, okay? So now why do we want to do that? Of course, with the disc lesion, you want to take the pressure away to help to relieve the pressure, so that pressure on your disc is not putting pressure on the nerve, okay? Now sometimes you might have a nerve that's being compressed by a bone spur, right? From arthritis or a degenerative spine. So those are the things that when you decompress the disc or traction, that's another name for it, we seem to want to move and progress, so everybody's using the word decompression nowadays, right? Because you have your VAX-D, which are one of the new, recent advent of decompression or computerized decompression for the spine. But really, all that is again, it's a traction. It's a computerized traction. So again, don't get caught up too much on, is it decompression or is it traction? It's just taking the pressure away from your spine, taking pressure away from your disc. No matter how you do it, is it decompression or is it traction, it's still relieving the pressure from your disc or relieving the pressure from your spine. So I'm going to be walking you through 4 things that you can do to have instant relief to take the pressure away from your spine to help you with your low back pain instantly. So let's walk you guys through 4 things that you can do to decompress your disc and have instant relief in your low back, okay? So the first is my favorite. It's actually simple. It's simple to do. You can do it at home. You can do it on your bed. You can do it over a chair, actually, even. As long as you have some sort of platform that's higher where you can hang on to one side or let your upper body down, and then allow you to hang your lower trunk or from your pelvis downward with your legs down to the ground, you're going to have some instant relief in your low back area. So I'm going to walk you through with the first one here. So this is a way to decompress your disc or to take pressure away from your low back, okay? So here I have is a little wedge, okay? So now you can do it without a wedge, right? You can do it on a normal table like this, okay? Where you can come downward, position yourself so that you can literally, all you have to do is bend forward here and push yourself up just slightly till your belt line is hitting the top of the table, okay? And once you hit that belt line, all you're gonna do is let your legs and everything drop down. And that's what you're gonna do, okay? Now, that decompresses and stretches out your low back, along with it also decompresses your disc, okay? Now, I like to add something, a platform, in this case here, a wedge. Now, if you don't have a wedge at home, which most people probably don't, you can try and put 2 or 3 pillows in there, underneath there, to give you a little more cushioning, to bring your pelvis, bring your lumbar up higher, so then you can drop the pelvis down lower. So in this case here, we're going to do the same thing. You're going to come to with this wedge here, come close to it, put your pelvis here against it, and you lean forward. And once you feel like your belt line is near the top portion of it, you're going to then drop it back down and let it hang, and you're going to feel a stretch and decompresses your low back. So that's very, very simple ways to have instant relief in your low back. Now, how long should you hold it? I would say try to hold it at least, a couple of minutes if you can do it. Now the caveat is that your arms might get, tired, right? So if you can find a way that you can do it where your body is able to transition into in that posture or that position longer. The longer, the better. You can even do it 3, 4, or 5 minutes if you want to. The longer, the better for this exercise to help to decompress your discs. So the next exercise to help to decompress your disc is the anterior pelvic tilt. The anterior pelvic tilt is going to be done lying on your back, okay, or a supine position. So we're going to get into this position here. And first thing that you're going to notice is that I'm going to bend my knees, okay? So bending your knees will take the pressure away from your low back, okay? When you keep your back straight like this, particularly when you're nerve pain, you're going to have more pain. So always bend your knees, particularly this one, you need to or have to bend your knees, right? So as you bend your knees, what I want you to do is you can rest your arms to the side or you can put it on your abdomen, okay? For beginners, you can put it on your abdomen so you can see how it's done, because you can feel how it's done actually. So what an anterior pelvic tilt means is that this is your front side or your anterior side, this is your posterior side or your back side, okay? So you have a posterior pelvic tilt and you're also an anterior pelvic tilt. So with the anterior pelvic tilt, all we're gonna do is moving your spine or your abdomen literally upward. So what you're doing is here, I'm gonna move my hands up a little bit so everybody can see here. My low back is actually arching a lot. So I keep my shoulder blade down on the ground, my buttocks down on the ground, and I'm arching away from my low back. Again, arching the back and holding here. You can hold it again for 10, 20, or 30 seconds to help to decompress that disc, to take the pressure away from the nerve and your discs. So the fourth exercise to decompress your disc is a typical bridging, right? So bridging, a lot of people know about it. They just don't realize how powerful and how important a bridge is to help to stabilize your spine, in addition to stabilizing your spine for prevention of low back pain. It's also a very, very good tool to help to decompress your disc, okay? So with this here, with this exercise, we're gonna have you in the supine position like this with your knees bent, okay? And here, all you're gonna do is trying to get your pelvis or your lumbar region here, right? Your pelvis and your lumbar. And you're gonna keep your shoulder blade on the ground, keep your feet on the ground, and you're gonna tilt your pelvis up. And once you come up, hold it there, 10, 20, or 30 seconds, and you come back down. Now, with that said, holding it for 10 or 20 or 30 seconds, if you can do it, great. Now, if you can't do it, then what I would recommend is you want to hold it for 2 or 3 seconds, however long it is, and it doesn't matter how high you go either. So if you can only go 5 inches up, it's fine. Go 5 inches up, hold it for 2 or 3 seconds. If you can go more higher, that's great. But then if you can't go if you can't go and stay up for that long of a time period, then you go up and do reps. You go up, hold it for 2 or 3 seconds, come back down, rest for a second or two, go back up again, hold it for 2, 3, 5, 10 seconds, however long you can do it, go back down. So hopefully as you do more and more of it, your back's gonna be much looser, your facet joints and everything's gonna be working and cavitating much more nicer, and you're gonna decompress your disc, hence you're gonna be able to hold it longer and take more pressure off your disc and off your nerve. Thanks a lot for joining us. I really appreciate everybody. If you can subscribe to our channel and also like our channel, because it means a lot to us that everybody is taking our advice, because my advice that I'm giving to you guys and giving to everybody, doesn't matter, it's from the smallest thing, from icing your low back to things to help to decompress your low back and your disc. The advice is the same advice that I give to thousands of my patients for the past 20 years to help them overcome back pain and other spinal conditions that they might have. Thank you.